I will now show you a video demonstrating the actual catheter usage technique. Before treatment, administer an infiltration anesthetic and a vasoconstrictor into the patient's nasal cavity by spraying. Remove excess intranasal mucus. Insert gauzes impregnated with the infiltration anesthetic and vasoconstrictor into the middle and common meatuses. Further infiltration anesthetic over and above the amount over the gauze may be sprayed into the nose at this time, but this spraying may also be omitted. After inserting the gauzes into the nasal cavity, wait for 15 minutes and then remove them. Insert the catheter so that the operative connector comes to the apex side of the nose. Inflate the balloon in the choanae by injecting approximately 10 milliliters of air through the pipe to close the choanae. At this time, ask the patient to gently say "ah" while inflating the balloon. Then, gently inflate the balloon in the anterior nares by injection of approximately 5 milliliters of air through the pipe. At this time, the front and posterior nasal apertures are blocked with balloons. Adjust the inclination of the patient's head. Attach the syringe to the operative connector and displace any retained fluid in the paranasal sinus with air from the syringe by pumping. At this time, pumping is started by drawing the syringe back. If you push the syringe at this time, you risk losing the airtight state. The space between the balloons in the anterior nares and posterior nasal aperture is now sealed, and movements of the ala of the nose will align with the pumping action. The model displays the pressure exerted on the paranasal sinus by the pumping. Adjust the treatment chair to a reclining position so that the patient is lying down, and prepare the drug formulation to be introduced into the paranasal sinus. At this time, orient the paranasal sinus on the treated side so that it is inclined downward. Attach the operative connector to the syringe and inject the drug formulation into the paranasal sinus by pumping. At this time, ask the patient to say "ah" gently while pumping. The pumping at this time is also started by pulling on the syringe. If you push the syringe at this time, you risk losing the airtight state. When pulling, bubbles appear as the drug formulation enters the paranasal sinus for the displacement. Bubbles during the pumping provide evidence that the air in the paranasal sinus is being displaced by the drug formulation. Deflate the balloon in the anterior nares and the balloon in the posterior nasal aperture, in that order, and remove the catheter. Raise the patient so that large amounts of the drug formulation do not reach the throat. In this video, the catheter was removed from the patient while he was still lying down, but you may remove the catheter after the patient sits up.